that a lot of guys or veterans that I work with, they already feel like they're wasting time, that they shouldn't need this. And so they have that self-condemnation. So then when they reach out and there's a frustration, be it the financial resources, be it time resources, then that's another problem right there. They're not going to continue to try to access care through a frustrating system.
When a civilian enters any branch of the military, they go through a period of basic military training that's designed to change the way they think and act to turn them into a soldier, sailor, Marine, airman, or Coast Guardsman.
Hard work, hard work. Hard work, hard work. Hard work.
This is seen as an important time in the individual's life, critical for the proper transition from being someone not in the military to part of one of the greatest fighting forces on the planet.
Earn more pay. Hard work, hard work, do it every day. Hard work, get up out of 2:45. Hard work.
After a period of time in the military, however, there's little done in any branch of the service to help that service member transition their mindset to life as a veteran.
Hard work, that's what they say. Hard work, I earn my pay. Hard work.
As we often say here in the Change Your POV podcast network, after one leaves the military, they're never going to be a civilian again. And they're no longer a service member. They're this entirely different third thing, a veteran, with all the experiences, knowledge, strengths, and challenges that go along with that word.
Hard work, manifest. Hard work, you gotta do it right. Hard work.
One of the most overlooked aspects of transition is a service member's mental health and wellness. If the veteran has their heart, mind, body, and spirit in the right place, and has a support network of family and friends to rely upon, then they're most likely going to have a successful transition. If those things are not in place, things can get challenging.
Hard work, in the early morning rain. Hard work, that's what they say.
I'm your host, Dwayne France, and I'm going to take you through a veteran mental health boot camp to give you some advanced training for your brain.
Hard work, everybody on the plane. Sit 'em on down. Hard work.
These episodes will cover the many different aspects of veteran mental health that I, as both a combat veteran and a clinical mental health counselor, see, experience, and support veterans with daily.
Hard work, I earn my pay. Hard work, hard work.
I'm going to be joined by both veterans and mental health professionals talking about what you need to know about the stigma against seeking support, the different areas we need to understand, and provide some resources for when you think you might need them.
That's what I say. Hard work, earn my pay. Hard work, do it every day.
Get up in the morning and out of the rack, because this is some information that could very well save your life. Welcome to Veteran Mental Health Boot Camp. Hey everybody, welcome back to the Headspace and Timing podcast. Again, and as always, we appreciate you taking the time to listen to us. We know that you could have chosen to listen to many other podcasts, or even no podcast at all, but you're choosing to listen to us. And you're picking up in the beginning of this series where we're looking at veteran mental health beyond PTSD and TBI. We're first, before we start talking about the specific conditions, we're going to talk about some of the barriers that exist for veterans and service members in seeking mental health. You know, we just got done with a conversation with David Smith about sort of the internal stigma that keeps veterans internally from reaching out. And today we're going to talk a little bit about the things that exist sort of in the environment that keep veterans from being able to access treatment or barriers that exist. And so to join me, I've got a colleague that I think that we've worked sort of in the same place and for the same in the same community for a couple of years now. And her name is Erin. And Erin is with the University of Colorado Springs. So Erin, welcome to the show.
Hi, Dwayne. Thanks so much for having me.
Of course. Thank you for making the time. Really looking to have conversations with mental health professionals who are serving veterans. And you've been doing that for quite a while. So before we get into that, how about you tell the audience a little bit about yourself and sort of what you're doing?
Well, I've been a therapist specializing in post-traumatic stress disorder since 2003. I've been with the Lane Center about 3.5 years. They have a specialty clinic called the Veterans Health and Trauma Clinic that treats primarily those involved in the military, whether or not veterans, active duty, family members, those sorts of things. I'm an EMDR approved consultant through EMDRIA. In my spare time, I like to draw and write and go on Jeep adventures. But PTSD and helping veterans is my passion ever since I landed in this position. And I'm just grateful to be able to be on your show today and be able to talk about helping folks improve their access to care and what might block that for them.
So in specializing in trauma since 2003, what really sort of drew you or got you involved in veteran mental health specifically? Because that's sort of a broad, working with trauma, of course, teens and families and maybe things like that. But when did you first start working with veterans, and why did you work with veterans specifically?
Well, through some of my work with families, I started to work with more dependent adolescents, and it really became a passion for me to get to work with the family unit, and then understanding the experience of the veterans, both when they were deployed as well as when they came home to deal with the family as it was. Being in this community in Colorado Springs, I take a lot of pride in our veteran population, and it was really important to me to be able to do what I could to really help folks who've been in this situation. It was a learning curve, that's for sure. I know that you were really, really an expert on cultural competency and in bridging the gap between civilian therapists and the veteran community. And so that was something that I had to really work on, especially that first year, really understanding this community. But I tell you, once I've started, I can't stop. I love working with vets.
And so from even in 2003 and in the very early years, we're going to have Dr. Kidd on a later show in this series talking about substance abuse. But he bridged the gap. He started his substance abuse program in 1999 and saw the shift as post 9/11 veterans started coming back. You started seeing that with families, the impact of maybe multiple deployments or even mental health concerns. You saw that first on the families you were working with?
I did, and that started probably in around 2006 or 2007,
right.
When my work really honed in there. I did work with victims of domestic violence initially, and we saw some of that where I was at, but really things started to heat up for the folks I worked with, the community I worked with in the middle of the 2000s.
And so, and that's having worked even with families and then with veterans for going on, these past 10 years, that's why I really appreciate coming in and talking about what you see as some of the barriers that either keep a veteran from accessing services or even the barriers that veterans experience sort of in the community. So maybe we can just start there. What do you think when I say barriers to care when it comes to veteran mental health? What comes to mind for you?
Well, one of the first things I think is just finding an access point. For most of the veterans I work with, I think that's one of the hardest things. There are a lot of community agencies and community partners that I work with and that I know you work with, and there are a lot of well-meaning people, and it's hard for them to find a common ground or find a meeting point where they can make a veteran feel comfortable coming in. I attended the VA Suicide Prevention Summit last summer at some point, and I was amazed at the support there is in the community, because I don't hear about it as much from the folks that I work with, and I work with primarily male veterans. So please excuse me if I say guys a lot. I do have female veterans as well. I just default to that sometimes. I mean no disrespect. But I think that one of the major things is being able to bridge that gap between awareness of services and the services that are out there for the veteran. There seems to be a missing access point there, I see.
So, yeah, no, that's great. That's a missing access point for mental health specifically, or a missing access point for maybe services in general?
Well, on the mental health end of things, that's where I see a lot of that. But overall, I think that there are so many well-meaning charitable organizations and nonprofits, as well as for-profit places, that really want to do good services, and they, and maybe this is part of where you come in with your cultural competency ideas. People don't know how to speak to veterans. People don't know how to be where they want to be necessarily. It's a different, I think it's a different culture, obviously, and I'm not sure that civilian populations really understand all the time how to get a good access there, and how to reach out. And so I think that kind of one of the first major barriers is veterans not knowing what's out there at all in some cases.
And I also don't wonder if it's just a matter of too many choices, right? We know that psychologically, too many choices, analysis paralysis. If I have 37 flavors of ketchup, I'm just going to stand there and stare at because there's just too many choices.
Right.
I call it...
Right, and walk out without it.
Yeah, and not even, and just be like, forget it, I'm done, and I'm just not going to eat with ketchup. But I call it starving at the feast. There are so many resources, and everybody's clamoring for the veteran's attention, and everybody's trying to help the veteran, but there's so much chaos going around that ultimately the veteran's just sort of like, I don't know where to start, so I'm just not going to start at all. And so right. You're right.
I think that's a big one. And, also, I think that some veterans have had negative experiences with mental health and services in the past. Maybe while they were getting out of whatever branch they were in, at one point. And there's this idea that, there's all these smiling people ready to help them. And they're like, I don't want your help. I don't need your help. You guys are all the same and that sort of thing. And so I think that service providers being able to understand that and understand their approach to this population would be a critical thing.
And yes, I have been rather gracious for some of our colleagues who purport to help veterans that may be less than helpful for veterans. When you say they have that bad experience with a clinician, that once a veteran has a bad experience with one mental health provider, they sort of extrapolate that to all mental health providers. And then, is that what you're talking about?
Yeah, and I think people mean well. I think, and again, I'm going to refer to your cultural competency stuff. I think that people don't understand that it's a completely different culture, and so the kind of things that work in your community mental health center or in your private practice don't necessarily translate to this population. And so on our end of things and on the service provider end of things, I think that being able to reach out in a way that is effective and is respectful is important.
Yeah, I think that, and you said before, you mentioned a couple times being well-meaning, but well-meaning is not enough.
The road to disaster is paved with good intentions, right?
Right. Our again, another valued colleague, Josh Krameyer, who he's coming on.
Oh, yeah.
So Josh is going to be talking about the family systems aspect coming up in a later episode. But Josh tells this funny story, and I relate it for the audience, that he was at a community meeting, and a very nice, pleasant little older lady came up to him and knew that he was a mental health professional and said that she wants to connect with him because she makes soap. And the soap that she makes has specific fragrances in it. And if the veterans would just wash with this soap, then they would be cured of the PTSD. And my wife would say, bless her heart. But
bless her heart, right.
Bless her heart. But, so very well-meaning, very, yes, nice, but PTSD is not dirt that can be washed off or whatever. But it's not effective. And so maybe that's a barrier, is that there are so many well-meaning people that are not understanding mental health in general or even how to specifically help effectively. Is that what you're seeing?
Yeah, I mean, I think that's probably one of the first barriers. If I'm a veteran going through the system, and I can't find the right service, that's my first barrier. I'm going to become unmotivated. I'm going to possibly give up. Like you said, I'm just not going to eat with ketchup. The next point is finding, once you find the service, once a veteran finds the service, is being able to access that service. I know, as well as I'm sure you do, that a lot of the places that provide services for veterans are flooded. Again, it's that idea of how hard do I have to try to get this help, because I already am suffering. I'm already struggling. And so once a veteran reaches out, and this is true for all folks, once you reach out so many times and you feel like you're not successful, there's that access lost again. And so I think finding access to good providers that have availability along that line is also really necessary. I mean, we have an enormous veteran population here.
Yes.
And go ahead.
And just to give people context, again, Erin and I are in Colorado Springs, but in even the updates over the last census, 98,000 veterans, just individuals who identify as veterans, live in and around El Paso County. That's not counting our active duty population from 5 military installations, and that's not counting spouses and children. And it's a town of 500,000, people or so, medium-sized U.S. city. So even if you look at that, let's say, rounded up 100,000, even the prevalence rate of PTSD, even the lowest one of 11%, that's 11,000 veterans in El Paso County that may be struggling with, PTSD or some other mental health concern. We don't have the capacity for that. If me and Erin and every therapist who is culturally competent, or even every therapist in Colorado Springs, if every veteran woke up tomorrow and said, I'm going to make an appointment with a mental health professional because that's what I should do, there's no way that we could service the demand.
Absolutely. And then on top of that, then you get to the more systemic or procedural sort of barriers, which is funding for services. Not every veteran is able to access cost-effective services within the different structures that are there. Not every veteran knows how to access those services. And I think that there's just a lot of complications along that process. And for some folks who have a really low frustration tolerance, and I think one of the things that you may have spoken with a previous guest before is this idea that a lot of veterans that I work with, they already feel like they're wasting time, that they shouldn't need this, and so they have that self-condemnation. So then when they reach out and there's a frustration, be it the financial resources, be it time resources, then that's another problem right there. They're not going to continue to try to access care through a frustrating system.
Yeah, veterans don't need much of a reason to avoid mental health treatment. Right? Any reason is a good reason. Absolutely.
And I think that's it's a sad reality in a lot of this stuff. You read about it in the papers. I don't know if people read papers anymore. They get their news on the internet, but we send folks to war, and then we expect them to come back, and we don't have the infrastructure to care for them in a lot of places.
And that, of course, is true for the Department of Veterans Affairs. Of course, you and I work with our local community-based outreach clinic, and we have colleagues. And I'm sure that you do, and we've talked about this before, have immense respect for clinicians that we personally know, of course, here in Colorado Springs. They're just overwhelmed.
It's incredibly overwhelming. There just isn't the capacity. The folks that I work with through the VA the ones that I work with are great people who really care. There's just not enough time. There's not enough hours in the day.
And so then when we're community providers like you and I in different capacities on a local level, or when national organizations such as the Cohen Veterans Network, we had Anthony Hassan in on one of our earliest podcasts, or the Headstrong Project, which you're working with, even though this capacity is there, again, if all the veterans, I think somebody once described it to me as, you keep wanting me to come knock on the door, but when I knock on the door, I expect somebody to answer. And so then when nobody answers, I'm just going to walk away.
Absolutely, and I think I like that analogy a lot because I think that's true. Or when somebody asks for identification or proof of insurance when they answer the door, that's another thing I think that I come across when I have some folks trying to access non-mental health services, because I try to link to different providers for different things, and then there's 20 pages of paperwork proving that they're a veteran, or they need to talk about their worst traumatic experience on the phone to a stranger. These are things that are, I understand the process, I understand why there's a process, but it's really hard, and the people that are capable of going through that process may not necessarily be the ones who most need the service, if that makes sense.
Right. And there's those additional barriers, but there's a point I think that I'd like to talk about for a minute is we're at you and I as caring individuals who are competent in our craft, we want to help veterans, but we're also mental health professionals. We have a master's degree, much like anyone else with an advanced degree, and of course we have our own mortgages and bills and things, and so I get the sense that some people say, well, you should just see veterans for free. You should just, you shouldn't charge veterans for their mental health services, and that's not even realistic because you would have even less providers in that.
Yeah, that's always a really hard one, because I don't want to charge somebody for coming in, and I got to eat. And so I think that this falls on different areas. And, I don't want to go off on a tangent or anything. I do believe that our country needs to take care of veterans, and they need to take care of the providers of those veterans in some way. I think that working with veterans has been the hardest job I've ever had, and that includes working with, victims of violence and torture and those sorts of things. But it's also the most rewarding. It's the one I look forward to the most every day. And so I have a passion and a commitment for it. And, we don't get rich in this field, and nobody wants to, but we do have to eat, and we have to navigate those systems as well. There are programs in place that make that harder for providers in order to get access to the funds to help the veterans.
Right. And
okay to say, yeah.
Yeah, no, and that's exactly, and again, it's a barrier that we must contend with as professionals. That the community might say, well, you should just see veterans for free. And many professionals do, much like Give an Hour, as they donate time to a wonderful program, but you can't build a practice on that, because if you're not paid, then you're not there doing that. I mean, it's much like trying to find pro bono medical service or pro bono legal services. A lawyer cannot build a legal practice on not charging, and so this is a challenge. Nobody wants to talk about money. Money is the horrible thing, but the fact is if the veteran doesn't have the funds to pay for their treatment, just like they don't have the funds to pay for their electric bill, that money has to come from somewhere. And so, you and the Lane Center there at UCCS and me with my program, trying to find other resources to get other people to pay us to see veterans so that it's not the veterans' cost. And that goes into the responsibility of the country in many ways to support that.
Oh, I couldn't agree more on that end, Dwayne. And I think that, the Cohen Foundation that you mentioned, as well as the Headstrong Project that you mentioned, I mean, there are some fabulous organizations, some fabulous philanthropic, organizations that are really committed to that. And that's great for us to have. I think we just need more.
Yeah, and the maybe this is for me, mental health was always or is not just veteran mental health. There's a stigma against it in the community, just as there's a stigma, an internal stigma against it in the veteran. But it's one of those sort of afterthought things that there should be only if a veteran needs it, then they go somewhere else and they get that there, right? It's sort of this shed that's in the back that nobody talks about. And that's really sort of...
Right, and I think,
yeah, go ahead.
No, go ahead. I just think that's an important point. I think that the mental health stigma just in general is a big deal, and seeking mental health treatment is a big deal, and those in mental health treatment feel that. And I think that there's a double layer on top of that for veterans. There's been a lot of bad press in regards to veteran mental health and veterans who needed mental health services and didn't get them. And I think that people then really don't want to have to deal with it. You know, there are those questions where that person needs to be better. Don't let them near me, sort of thing. And then that's heartbreaking. You know, there's a whole other layer there. That again, why should I bother when nobody wants me around anyway? Those sorts of things that are not true, but that feel true. I mean, they are true in some situations.
Right.
I think that one of the. Oh, go ahead.
No, and that's just to touch on that real quick is everybody says I love veterans. The yellow ribbons and wave the flag and I want to support the vets, unless I have one sitting next to me in the next cubicle, or unless I have one in front of me because they might if they deployed to combat they might have the PTSD, and that's a line, right? Yeah. But there's those stereotypes. At a distance, we love them as heroes, but when they're up close, they're a little sketchy. Do you sense that?
Right. Oh, no, I'm not trying to offend anyone, but I think that's an absolute truth. I actually was working with an unnamed organization in trying to get one of my guys access to care through them at a residential center. And, I was talking to the screener, and she was like, well, do you think he can tolerate this? Do you think he can manage it? I'm like, he has 4 deployments. Like, he needs this. Like, I'm sending him here because he needs it, not because he's going to make your newsletter as a veteran success. I would like that, but it's not, it's not for me about you having good outcomes so that you can say you help the veterans. It's about me getting help for the veterans who need it. And, it just made me feel kind of icky. Like, who do you think we work with? Mental health is a serious issue, and not everybody can be the poster child on your website, because these are real people with real issues who have done real things in service to this country. Anyway, I was upset for days over that.
Right. I mean, and that's the thing is just these assumptions of. I'll link to it in the show notes, but there's a guest post on the blog where he talks about being one of those weird veterans in the workplace that they were treating him with kid gloves, that they said, if you have an episode, then you can take a break, or, and everybody was just kind of beating around the bush. And another story of which one of my fellow co-hosts, Jeff Adamek, on his show talks about how he once made an offhand remark of killing somebody with kindness, and he left the room and found out they had a 30-minute conversation about do we need to report it? Can he kill somebody? Is it possible to kill somebody? Does that mean he would be kind? Well, and it was just any other offhand remark, but the fact that he was a combat veteran led people to make different assumptions. And so that's a challenge, like you said, that just says, veterans, forget it, I'm not doing it.
That is one of the most ridiculous things I've ever heard. In some way we have to honor and respect that the culture is different. I mean, that's true. And in the other, they're just people.
Right.
I mean, these are people. Like, and I think that's the heartbreaking thing is that when I work with my folks day in and day out, they're just trying to be people. And they're not trying to be the weird guy at the bus station that nobody wants to sit by because he's wearing, heaven forbid, camouflage pants. That's so I think that the environmental stigma forces isolation. Why would I go out? Why would I get help? Why would I do these things? Because it's much easier for me to just hide, and I'm not a problem to people. The veterans that I work with, one theme that runs through, I would say, every single one. Now, we never say 100%, but currently the folks I work with, 100% of them don't want to be a burden.
Right.
And we know that the sense of burdensomeness is one of the highest risks of suicide. It increases the risk of suicide. And so you take a population who is used to serving a greater mission, you take away their mission, and then so suddenly they're not in their eyes, they're not doing anything good, but in fact, they're on the opposite end of that, they think. And we reinforce that in our communities and with these stigmas by making them feel like they're a burden when they're absolutely not. So why not isolate? I think I hear that so much. None of my folks wants to be a burden. They often say, I'm sorry, I'm wasting your time. And it just shocks me because, first off, I get to decide if somebody's wasting my time, and if you're not it. And I mean, but that's the sense that they get. These are people of duty. These are people of honor. These are people who, regardless of what they've gone through and been through, don't want to cause trouble anymore or be a burden. And we continue to perseverate on that these people are different and need to be stayed away from.
Right, and that shows how complicated and how connected both the external stigma and the internal stigma can be. I call it, the villain, victim, and vindicator. So either they're this crazed John Rambo gonna take over the town and shoot up the place, or there's some broken-winged bird or a three-legged dog, and oh, you poor baby, or oh, I'm just oh, come on, or
right, here's some soap.
Yeah, here's some soap, and but I, if you treat me like a villain, I can show you how much a villain I'm going to be, and it becomes a self-fulfilling prophecy. And I don't like to be called a victim, and I'll throw that back in your face. Or in some cases, some veterans like, fine, you want to, treat me like a victim and give me everything, I'll take all you can give me, and so it can be the manner, the stereotype can become reality if it's perpetuated by the community.
Right. If the community pushes it hard enough, we get what we ask for in that way.
Right.
And that's not at all helpful for these folks. It's just not at all helpful. They're people with complicated situations. Like all people have complicated situations. They require cultural competency. Like all people require cultural competency. We don't need to tiptoe, but we need to be respectful. And I think that's a main line in regards to all treatment providers. If handing out soap actually worked, that would be fabulous. Understanding that it's deeper than that is a bigger deal, and understanding how to help these folks feel like that you're actually, an ally, that you get it. No, I can't get it. I was never in combat. I'm a civilian, always been a civilian, married a civilian. I don't know what it's like there. However, that's up to you to tell me your story, because your story is different as a veteran. Each veteran has a different story. But there are common themes, again, with that cultural competency. And the stories, I was involved in a show through UCCS. It was a reading of several plays put together by the theater department through their program, the Homefront Project, which I know you're familiar with. And the director of this, his name is Max, he's a wonderful guy, picked together several pieces of Shakespeare in this first reading. And the story of war was the same, and the story of post-traumatic stress disorder was the same kind of throughout the ages. And so there is a similarity that runs from as far back as Shakespeare and even further. They'll be doing another play in March that will kind of attest to that.
And I like that you, and of course that you brought up, and not that you were hiding anything at all, but that you're not a veteran, you've never served in combat, and yet you're effective in working with veterans. I think one of the things is because you've taken the time and the effort to learn to become culturally competent. Sometimes it can be a challenge for me because veterans will be talking about something that I can tell that maybe we might need to address. A memory, and then they'll get to maybe a hard part, and then they'll say, "Oh, well, you know what it was like because you were there." I know what it was like for me because I was where I was, but I don't know what it was like for you and where you were. And you're really just trying to get out of not having to address or but even for me, it's. Even being there where I was, we could be sitting in the same truck. Literally, I've had this experience with one of the guys, one of the dismounts in my vehicle, that we remember a pretty significant incident in two totally different ways. And so, you taking the time to become culturally competent makes you stand out from other providers who may be serving veterans who don't take that time?
Well, and I think you bring up a good point there, Dwayne, as well, in regards to veteran providers who want to help veterans. There's a flip side of that as well, which is that I don't have to necessarily address it because you were there, and so they don't want to get into the issue, right? Or there's veterans who have not necessarily done the work that they've needed to do, or who don't understand that maybe their experience in the military was different. And so I think that whereas there are a lot of benefits to being a veteran service provider for veterans, there are also benefits to being a civilian one, because I don't have a lot. I don't know. I'm not going to go, because it's not my life.
But,
and so, no, because you're culturally competent that you do not speak for all veterans. And I think that's one of the things that's true of cultures in general, is understanding that you don't speak for all veterans as a veteran provider, and I don't speak for all civilians as a civilian provider, which is something that takes some getting used to sometimes, being put in that civilian category, but I'm quick to get out of it.
Right, but and even then, there are benefits, as you said, to not working with someone who is a veteran. I have, recently worked with somebody that said, I literally will not go see anyone unless they're a combat veteran. I don't care. And we have to honor that, of course.
Absolutely.
Because that's where that veteran, not, oh, you should, and you'll go see who we say you are. That's where that veteran is, and we meet him where that veteran is, so we take it, and we do what we can. But then I have had clients in which the whole senior NCO Army thing was maybe a source of their frustration, and we really didn't get along very well, because just me as a retired Army non-commissioned officer triggered them, literally.
Right.
And so, okay, let's put you with someone who is not a veteran. That's who you're going to work with. So understanding that, not all veterans are going to work with all clinicians, and having the flexibility. Well, number one, having the honesty in ourselves to recognize that I'm not the person for you, and I'm going to do all that I can to find you the person that you need, rather than just signing you off and letting you go.
Absolutely. And I think that's just true of cultural competency in general. If I'm a female and I would rather see a female therapist, that's going to be honored, I would hope. If I'm a female but my mother was abusive and I want to see a male therapist, it's the choice of the client. And I like what you added at the end about finding the right fit for that person, that the burden is on us to understand when whatever we carry into the session is ineffective for the client, and to help that client find somebody new. And I'm not sure that a lot of the folks have that experience of someone who is compassionate enough to do that, to say, hey, I own it. I'm walking in here as this, little civilian girl, and I might not be the person for you, and I'm not mad about that. The problem isn't you. The problem is the situation. And so, again, it goes to understanding cultural differences, and it goes, again, to being aware enough of ourselves as clinicians to be able to know that and realize that it's a situational issue, and not me as a clinician. I'm not a bad therapist because I'm a civilian, but that's not a bad client because the client doesn't want to work with me because I'm a civilian. You know what I'm saying?
Yeah, absolutely, and I think that that goes a long way. As you know, I work here with our agency with several excellent clinicians who are not veterans. I may have a little bit of a shortcut with them to building the rapport, but any clinician who takes the time to understand veterans can get there, not even eventually, but relatively quickly. One of my other guests, Jay Knight, he's a Marine, has his own podcast, but he talks about his journey of seeking therapy, and he went into his therapist, and his therapist says, well, I'm not sure that I can help you because I'm not a veteran and not familiar with the military. And Jay said, I'm not coming here to talk to you about my veteran stuff because I'm a veteran. I'm here talking to you about my humanity because I'm a human.
Nice. Exactly. Yeah. And I think if we remember that as clinicians on all angles of things and working with the veteran population, that's what it takes. It's sad that your friend had to explain that to the therapist. But, it's a learning curve. And I think that but what we do in those situations, hopefully what therapists do in those situations, is take it and grow.
And I think, yes, it is a learning situation, but it's also a learning situation with veterans. And it's hard if a veteran is in a place where I finally worked up the courage to reach out for help. Again, the metaphor, I've knocked on the door, and the person who answers the door may not be the 100% match that I'm looking for. Maybe I need a little bit of patience and knock off some rough edges to be able to give it a little bit of time and maybe help that. You know, and when we talk about cultural competence, yes, absolutely, it is not the client's role to teach cultural competence to the professional. And no professional should understand that. It's one of the reasons why I do the blogs and the podcast, is to help other clinicians who may not be familiar with veterans learn something other than having their clients tell them. And that's really the challenge. But I think the lack of self-condemnation maybe goes, it works on both the client and the counselor in this.
Absolutely. I agree with that. I think that's a good point. We're all just people, right? Again, at the end of the day, we're all just people attempting to get through and attempting to be understood and to understand. And I think that if you find that as a veteran seeking services, or if you find that as a clinician trying to expand your practice, that's good advice on both ends of things.
Now, you had worked with significant trauma for years before you started working with veterans, and so even though you may not have been culturally competent in veteran speak, so to speak, you were clinically competent, and I think that's what a lot of our colleagues seem to miss, is that I have skills. There's a whole field called existential psychology that helps veterans understand purpose and meaning, and the lack of purpose, as you said, that they no longer feel connected, that clinicians who are not culturally competent don't recognize that that's something that they can actually help with. They just assume all veterans have PTSD. Do you see that?
I'm trying to figure out your question on that. I think that PTSD is so easily put in that bucket. And when I think of PTSD, I think of it as one piece of what the veteran experiences. Is that what you're talking about, as opposed to like?
Yes.
I mean, a lot of people are like, I treat PTSD, but not understanding. When a lot of the time when I think about veterans, I think about people who have lost what they once had. In the sense of, there's no more, and I said this before, I hear a lot that I don't have a mission anymore. And we can talk PTSD all day long and flashbacks all day long, but that doesn't fill that void of a loss of mission, of a loss of camaraderie, of a loss of those things. Some folks feel isolated and alone because they think they're the only ones that are suffering, and so they voluntarily cut themselves off from their communities, while everybody else in their communities cut themselves off as well. PTSD is part of the issue, but that's, I guess, the diagnosis and not the whole picture.
Right, and it's only one facet of it. And I think that
right.
You as a clinician, or anyone who is trained as a mental health professional that maintains, of course, their study and their discipline. They have tools that can help address that lack of meaning and purpose and lack of mission. They just don't know that it applies to veterans because they've not taken the time to understand that that's an aspect.
Oh, that's a terrifying thought, Dwayne.
Well, I mean,
that is because significant healing has to occur within a significant relationship in those senses, and you have to understand. I don't know. That's frightening. I mean, PTSD is a thing, but it's part of. It's part of this greater picture. What is the point of, if I had a satisfactory life, if I felt connected, if I felt useful, I could handle the nightmares. I mean, I hear,
Right.
I mean, it is one part of a giant, you have the wheel that you make, the one part of the giant understanding of what it is to be culturally competent. And I guess maybe that's one of the things that people who don't work with veterans, I guess that's what your point and what you were saying, that they people come in with a diagnosis, and when we treat that diagnosis and we send them on their way. That's not like that with veterans. It's not like that with complex trauma typically, and it's not like that with veterans because it's a much bigger deal.
Right, and I think that even ties back to what you were talking about as resources in the community. Is there's millions of resources. There's millions of people across the U.S., but they're only trying to address one aspect of the needs of the veteran. This is something that before I moved over here, where I was working full time at the Crawford House. You and I both work with the Veterans Trauma Court, so we had residents at the Crawford House who were homeless that were also in the judicial system. So that's two problems. Then you had them being served in a mental health capacity with a different agency. That's a third. A fourth one was trying to get them employment. A fifth one was trying to get them long-term housing. And so each of these agencies were dealing with a facet of the condition, but it was the same veteran accessing all of them, and there really wasn't a comprehensive look. And that's where if we're just treating one aspect of what the veteran needs, then we're missing the whole picture.
Right, and just like you were talking about with the situation with working with someone who's homeless, who's in the criminal justice system, who has mental health stuff going on. I mean, my head is already spinning with the amount of paperwork, with the amount of appointments, with the amount of things I need to remember, the amount of places I need to get. There's all these people involved in my life, and they all mean well, but none of them are connected. And so then that puts the burden on me to figure it out, and I'm the one hurting.
Right, and I'm the one with the most responsibility, and even sometimes the least capacity to be able to engage that responsibility.
And I think that's a really important point. I think obviously our clients are responsible ultimately, but it's understanding where the bridge of responsibility crosses in terms of capacity. You take someone who has a traumatic brain injury, who the family has rejected him. He's homeless, again, criminal justice system, maybe some substance abuse issues on top of mental health. And the expectations that we have of this person to manage and juggle these things are not realistic. And I think sometimes as service providers, I hear people get angry at the client for this. And sadly, this is a true statement that they get angry when, what do you expect? Like, we have to help bridge across that and bring them towards the capacity to have more responsibility. Does that make sense? Is that kind of what you were talking about?
Yeah, no, absolutely.
Firmly.
And that's what I think, and not even just nationwide, but just in general, in communities, just that idea of, hey, veteran, what do you need? Not what do you need as far as what the first thing you say is what I'm going to address, but what is really the underlying aspect of, what are your needs, your fundamental needs? So if they reach out, they go to the place for long-term housing, but then they say, oh, you need to have a job first. So then they go to the job place and they say, okay, well, for you to get a job, you need to have a stable place to house. And then they're just ping-ponging back and forth and nothing gets resolved. And no one is helping them, I think, manage that.
Right, and let's say this person goes to therapy and the therapist says, I don't want to talk to you about your housing. I don't want to talk to you about your employment. We're here to talk about your deployment. That door just got slammed in the face because the clinician is not seeing the whole picture for the veteran, all the systemic things that work there. And I hear that sometimes. People are like, well, when are you going to do EMDR on so-and-so? And I'm like, are you serious? You've got to be kidding me, right? You're joking. Like,
prolonged exposure doesn't solve homelessness. Maybe
no, no, it does not.
Well, I think that we've got the place. We're painting a pretty bleak picture here, Erin. Give us some hope. I mean, there's obviously these barriers exist, but they're we're trying to overcome them.
Yes, I think there's a lot of good work being done, and I think that if clinicians and service providers are more willing to look at themselves and take steps to be culturally competent and understand some of these concepts, the problem is going to solve itself in many, not totally, but in many ways with that. I think that as much as we can as providers, and folks listening to your show who are providers can understand that holistic piece in terms of what the veterans' needs are, and not just the one facet of it, then we can help access that. I think that if we as therapists are no longer a barrier, then that will make a huge difference. I think that if the veteran is able to land in the right place, maybe not the first time, but at least the second time, with someone who's willing to understand that, hope's there's nothing but hope, nothing at all. I mean, I think that as clinicians, we just have to have a lot of patience and understanding and willingness to not be cookie cutters. We do some great work at the Lane Center at the Veterans Health and Trauma Clinic. I know you're doing incredible work there, not only with the place you work, but with the side programs that you have going on in terms of some of the nonprofit work. I know here in Colorado Springs we have, Trauma Court, Veterans Trauma Court, which is an incredible organization that helps justice involved veterans to folks who maybe did not get services when they need them, but then is able to get those access. I think that if as a nation we are more willing and able to see this as a societal responsibility, then we can go so far. There is so much hope. There are good people doing this work, and I don't want to discourage people from seeking help. I want to encourage people that there is the right help. They might just not find it right away.
Right, and that's something, and you say that we as mental health professionals in the industry, and one of the reasons why even I started the nonprofit and started this podcast is because we need another nonprofit like we needed a hole in our head, but the resources just weren't there. Mental health professionals are not talking. We need better PR, I think, as an industry, to be able to get the message out that it's not about waiting until you're in crisis. It's not about sitting on the couch talking about your mother. Unless your mother's the problem, then we talk about your mother all day long. But
we'll talk all day about her.
Yeah, but it's not Freudian psychotherapy where we're interpreting your dreams or things like that. It's we as mental health professionals have very effective and proven methods to help veterans live the life that they hoped they would live when they left the military.
Absolutely. We are out there, and I, you said that about your nonprofit, about another hole in the head. I think that we need more nonprofits like yours, not necessarily the nonprofits who maybe
make soap.
That's one. Well, yeah, I keep picking on the soap situation. It's such a fabulous one to pick on, though. But I mean, I think that that if we actually ask the population what is successful instead of coming up with our own ideas. I mean, you said earlier, the idea of here you come to my office and this is what I can offer you, not what do you need from me. But if folks who want to do good can actually ask the community of veterans what would be helpful, that would be a really, really big start. I think mental health, accessible and effective mental health treatment would be high on that list for a lot of people. Do they believe it's out there? They may not yet. But that's what I appreciate so much about the work that you're doing with this, is being able to increase that access and awareness to things that actually are helpful.
Now, and you just made that a very excellent point, is that so many of us, and I'll include myself, or anybody trying to serve veterans, that we're in love with our solution to a problem that we're not even certain what the problem is. We're providing a solution and in love with the solution that we have to provide, when the problem, and this is what I'm learning, is just awareness about veteran mental health and the stigma against seeking help. That's the problem we need to solve first. Then we can start to solve the next problem. But you're talking about identifying the problem and then developing a solution, not trying to fit the solution to what I think the problem is.
Right. There's the old quote, when all you have is a hammer, everything looks like a nail. But maybe we should get more tools in our belt and understand maybe what tools are needed from the people before we just start going to the store and buying all sorts of tools that we like.
Right.
I like this hammer. Okay, well, the hammer is only helpful, in X percentage of situations.
No, I absolutely agree. I think you're right on target. And again, in what I have found is I'm going through these series, we could literally talk about this all day. I mean, these are just, there's so many different facets of what we're talking about that we're not talking about in public. And I appreciate you coming on and having the conversation in public.
Dwayne, thank you so much for having me on your show. It's been a real treat talking with you. Again, we could talk for hours, but I know time is of the essence.
Well, yes, and I appreciate you coming on for this. As I'd mentioned, I was hoping to have you and Valerie and talking specifically about the Lane Center and have you back on the show at another point. But if people were wanting to get a hold of you and learn more about what you're doing and things like that, how would they find that out?
The main number for the Veterans Health and Trauma Clinic, and is part of the UCCS Lane Center, is 255-8003. My direct line that I can answer when I'm not in session, or I can return calls when I'm not in session, is 719-255-8072.
And I'm going to make sure that links to the website for the Veterans Health and Trauma Clinic are on the newsletter, and also make sure that those phone numbers are there as well, so veterans can go find those at changeyourpov.com and veteranmentalhealth.com. Once again, Erin, thank you so much for joining us today.
Absolutely, Dwayne. Thanks for having me. Have a great day.
Hard work, hard work. Hard work, hard work. Hard work, work.
So you just listened to an episode with Erin Fowler talking about the barriers, the external barriers that exist for veterans when seeking mental health.
Say, hard work, work, work. Earn more pay. Hard work, work.
You can find the show notes on this show and many of the things we talked about at either changeyourpov.com or veteranmentalhealth.com, looking for episode HST027.
Hard work, work. Another day to work. Hard work, hard work.
This is the third episode of Veteran Mental Health Boot Camp, a series brought to you by the Change Your POV Podcast Network and the Headspace and Timing Podcast.
Got to go make the call. Hard work, banging on the doors in the morning. Hard work,
If you're a veteran or service member, the family member of one, or support veterans in any way, then this series is designed to help you understand more about veteran mental health.
hard work, manifest. Hard work, you got to do it right. Hard work, and here we go.
If you're just now getting into the series, go back and check out episode HST025, where we introduce the concept of looking beyond PTSD and TBI in regards to veteran mental health.
Work, we're moving on out. Hard work, we gotta go and do the job. Hard work, load them up on the airplane. Hard work, in the early morning rain. Hard work.
Make sure you subscribe to the Change Your POV Podcast Network on your podcast player of choice, and sign up for updates at changeyourpov.com and veteranmentalhealth.com.
Fired up. Hard work, everybody on the plane. Hard work, sit them on down. Hard work.
We would love to hear your feedback regarding this series and all of the shows in the Change Your POV Podcast Network. You can do so by visiting our Facebook group, leaving a comment, or review on iTunes.
Hard work, I earn my pay. Hard work, we're on the hard work.
Remember, veteran mental health and wellness is the basis of a successful post-military life, and one that all who answered our nation's call to serve deserves. Remember, brothers and sisters, you're not alone. Ever.